Hi, everybody. I am Dr. Amy Bach. I'm a clinical psychologist, and I have a private practice in Providence, Rhode Island, and I also teach in the medical school here at Brown University. So in my private practice, I do cognitive behavioral therapy, and I specialize in treating anxiety disorders, and I do a fair amount of couples work. So I see adults both individually and in couples therapy. And I have a special interest in working with people who have obsessive-compulsive personality disorder. So that is what we're going to be talking about tonight. So just to give you an overview, see if we can get this going. Okay. All right. So first, just an overview, the objectives of what we're going to be covering tonight. First, just what is OCPD? So we're going to be talking quite a bit about what it is, what it looks like, how to recognize it in yourself or in other people. How common is OCPD? How does OCPD differ from OCD, which is a very common question? And then what are some treatment strategies? And also, if you yourself don't have an OC personality style, but someone close to you does, someone you live with, someone you work with, what are some strategies for coping? All right. Okay, so first, the DSM-5 is our diagnostic manual. So that has the diagnostic criteria for all of the different mental disorders. I actually have it right here. So this is technically the definition of OCPD. It is a pervasive pattern of preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency, beginning by early adulthood and present in a variety of contexts, as indicated by 4 or more of the following. So before we get into what those criteria are, broadly, I just want to explain for a second that the personality disorders are a group of diagnoses that describe a pattern in the way in which the person engages with the world, essentially. So we're going to talk a little bit more about this, but unlike the acute disorders like anxiety disorders or mood disorders that may come or go and be present only for a fixed period of time, a personality disorder is very central to how the person engages with other people. And because it's a personality disorder, there's something inherently problematic or difficult or disruptive about the way in which the person is engaging with other people. Now, a personality disorder falls along a continuum. And so it's not that you either fully have this personality disorder or you don't. It often occurs along a continuum. And so any given person has different personality traits. And so you might hear a description of OCPD and think, well, my aunt has that trait and my boss has that trait and my roommate has this tendency. So we can all have different traits. This is when a number of these traits occur together in the same person and are present pretty persistently over the course of their lifetime from early adulthood on. And so it's when enough of these traits occur together and they occur to an extent that it gets in the person's way. It causes problems in their relationships with other people and in the way that they function. Okay, so in the case of OCPD, 4 or more of the following, and that is to kind of technically meet the diagnostic criteria. So that is where we as clinicians would say this person's personality style fits the criteria for this diagnosis. So a preoccupation with details, rules, lists, order, organization, or schedules, such that the major point of the activity is lost. And I'll be explaining all of these and I'll give more real life day-to-day examples, but this is just kind of nuts and bolts, the criteria as they're defined or outlined. Perfectionism that interferes with task completion, excessively devoted to work or productivity to the exclusion of fun and friendships, over-conscientious, scrupulous, and inflexible about matters of morality, ethics, or values, unable to discard worn-out or worthless objects, reluctant to delegate tasks or to work with others unless things are done exactly his, her, their way, miserly spending style towards self and others, and shows rigidity and stubbornness. All right, so we're going to talk about, great, so this is how the criteria are laid out, but what does this really look like in kind of real life relationships and people? Okay, so before we do that, how common is OCPD? So OCPD is one of the most common personality disorders in the general population. The prevalence estimates range from about 2% up to about 8%, with a recent study coming out just in 2022 that estimated a prevalence rate of about 6.5%. So for a personality disorder, that is quite high. So it is common. And again, for the purposes of our discussion tonight, we won't just be thinking of people who have full-blown OCPD who meet the diagnostic criteria, but folks who have traits of OCPD and may not meet full criteria, but exhibit some of these tendencies, that can also be hard. So that the prevalence for that would be even higher. Now, the literature regarding gender differences is inconsistent. Different studies have had different results. Some studies suggest that OCPD is diagnosed more often in men than women. And OCPD is present in about 20 to 25% of patients who have OCD. So there is some overlap. So if you think of it like a Venn diagram, there are people who have OCD who do not have OCPD, and there are people who have OCPD who don't have OCD, and then there's an overlap in the middle. So again, of people who have OCD, about 20 to 25% of those have OCPD as well. Okay. All right, so one of the questions people often ask is, what is the difference between OCPD and OCD? So there are a few differences. So first, OCPD, as I mentioned earlier, is a personality disorder. So that is different from an acute disorder such as OCD. So OCD is an acute disorder, and that means that it can be time limited. It may be something that the person experiences for a few years in childhood, and then they improve and the symptoms dissipate. It could be that they experience OCD for a window of time in adulthood, or that it waxes and wanes, it comes and goes. A personality disorder develops by earlier in life and then is persistent. And it is, again, as I mentioned earlier, a central part of how the person interacts and engages with the world. OCD involves the presence of obsessive thoughts and compulsions. So the central part of obsessive-compulsive disorder is the presence of these symptoms, the obsessive thoughts and the compulsions. Those are not present. They are not a part of OCPD. So a person with OCPD could have obsessive thoughts and compulsions if they also have OCD, but that would be a separate issue, a separate diagnosis. OCPD itself does not involve obsessive thoughts or compulsions. Now, within the realm of OCD, which is a broad diagnosis, there are a number of different subtypes. So there are people who fear contamination and are very anxious about germs and wash excessively. There are people who have obsessive doubting thoughts. Did they lock the door? Did they turn the stove off? People who worry that they've hurt someone without meaning to. There is also within OCD, there is a subtype that is sometimes described as the just right subtype. And those are people who have OCD who need for things to be just right. So things in the house need to be in proper order, things need to be symmetrical, they need for things to kind of be in their place. People who have OCPD also often like for things to be just right. They like for things to be in order, for things to be straight and in their proper place. So in that way, OCPD and the just right subtype of OCD can look very similar. A difference, if you want to think of a quick way of distinguishing the two, is that for people who have OCD, what they will describe is that if things are out of place, it makes them anxious or uncomfortable until they're able to correct it. For people with OCPD, they will not so much describe that it makes them anxious or uncomfortable. It's more that it's irritating to them. So if one of the frames in my office is a little crooked, if I'm seeing somebody who has OCPD, they'll give me the example and say, like, see that frame, for example, doesn't that drive you crazy? Why don't you straighten that? Or there will be like a piece of yarn on my floor and they'll say, see, like, I've been noticing this piece of yarn there. That's annoying. Why don't you just like throw that out? Whereas a person who has OCD will often say, if they're in my office, it doesn't bother me here because I'm in your office. But if it's my house or my room, I need for things to be just right. And if they're not, it just makes me anxious or uncomfortable. So there's a difference in how they react to things not being just right. Okay, and then in OCD, the person typically recognizes that his or her standards are excessive or atypical. So they kind of recognize that it's their issue, and they will come in often wanting help because it causes them distress. For someone with OCPD, they don't so much feel that the issue is theirs. They will often look to other people and say, it's not my problem. Like, other people are doing things that are annoying or problematic, and the other people are the issue. They need to kind of get with the program. So for folks with OCPD, they often will not seek treatment just of their own volition. They will often come into treatment because a spouse is saying that their behavior is difficult or problematic, or they've run into trouble at work. They're having difficulty getting along. Management has pulled them in and said, you've got to go and see somebody because you're having trouble working with people. Whereas folks who have OCD will come in and say, these different patterns that I get engaged in are causing me distress and I want help with them. Okay. All right, so now we're going to just get into what are some everyday examples of behaviors that are typical for people who have OCD. And I'll just give you lots of different examples based on people I've worked with. Okay, so first, and again, this is kind of moving away from the diagnostic criteria and really just getting into in everyday life, what do some of these behaviors and thought patterns look like? Okay, so rigid rules or standards about how things should be done, often criticizing family or coworkers for not meeting these standards. So for people with OCPD, they very often have a clear sense as to how things should be done, the right way of doing things. And this could be with big things, but it can also be with small, very seemingly trivial things. Like I worked with someone who felt like the towels should all be folded in a certain way, and so had trouble letting his partner put the towels away because it really irritated him if they weren't folded correctly. And these will overlap. We'll talk about the difficulty delegating in a minute, but one of the consequences of this is that for someone who lives with a person who has OCPD or works with them, you can feel like you're just frequently being criticized, and the frequent criticism can just get exhausting. It can be wearing. So this could be someone who, when you go to the beach with them, if you pack the cooler, they're going to unpack it and repack it because they want to do it correctly. A very common one is people have conflict over how to load the dishwasher. Like, you know, and we all know people who, if we load the dishwasher, they're going to take the dishes out and totally rearrange them to do it correctly. Like, any one of us might do a few of these things, but this is someone who's engaging in a lot of these different behaviors. And so one of the consequences of this, again, is that the person living or working with the person who has the sense of how to do everything correctly can just frequently feel criticized. And they might feel like the message is, the way you do things is not good enough, or you're stupid, or you don't do anything correctly. And that's just a hard feeling to live with. Okay, so activities that are meant to be fun become stressful because things need to be done correctly. And this word correctly will come up often. And the idea is that there isn't really a correct way of folding towels, but the person with OCPD will feel like, no, this is the right way to do it. And they will often feel like those are just universal standards. Like most people would agree with me, this is the correct way of doing it. So when it comes to things that are meant to be fun, it may be that you throw a dinner party with your partner, but because everything needs to be done just the right way, the table's got to be set just so, the meal has to be cooked just so, it stops being fun because it's so stressful that everything needs to be done in an exact way. Or this is the person who, when a group of people are together playing a board game, the person who has OCPD might have the rules out and they're saying, no, like, you didn't follow the rules. This is supposed to be done in this way. And, you know, the rules are part of the game and that's all good and fine. But this is the person who is so intent on following the rules that it stops being fun to play with them, because the point of the activity is to have fun and it just kind of stops being fun. Okay, difficulty not pointing out ways in which someone else has done things less than perfectly. So the person with OCPD has a lot of trouble not kind of calling people out on the things that they've done incorrectly. And it's not for the sake of shaming or embarrassing the person. It's actually because it's really hard not to correct it or just set the record straight. Like, this should have been done differently. So just to give you different examples of this, I worked with a very nice person at one point who had OCPD, and we met. He had my first appointment of the morning, and I tend to run just a tiny bit late in the morning. So I would arrive for a session a couple of minutes late, and it would be like 2 minutes late. And he was socially aware enough to know that it was probably okay to just let that go. But with the OCPD, he couldn't not mention it. So we would come in and he would sit down and he would laugh and say, I don't know, Dr. Bach, we might have to get you another alarm clock. Like, he kind of couldn't not mention that I was a couple minutes late. So there could be lots of different examples of this, but this would be like if your spouse is helping you out with something and they do different things to be helpful, but there's one aspect of what they did that wasn't the way that you thought it should have been. And you're grateful, you appreciate that they helped, but you can't help pointing out that this one little thing they should have done differently. I worked with a college student at one point who had OCPD, and he was very smart. He worked really hard. And when he went to class, if the professor made a mistake up on the whiteboard, my client had to put his hand right up and correct the professor. And I got the sense through enough examples that this was happening pretty frequently. If the professor said something that my client thought was not correct based on the reading, he had his hand up and was correcting the professor. And you could hear just through the examples how off-putting this probably was, not just to the professor, but to the people in class who I imagined just got kind of worn out by hearing all of the corrections, even though they were right. And we'll get to that in a little bit. Okay, so delegating a task might be hard because the person wants to control how it's done. And so the person with OCPD will often feel stressed because they have so many different things to do. But when they go to delegate it, either at work or at home, it's difficult for them because the person they delegate to may not do it well enough, may not do it the way that they would do it themselves. I keep using air quotes. That's super annoying. I'm sorry. Okay, so an example of this comes up in couples therapy a lot. Like, I've worked with a couple and the one partner said, I feel like I'm just having to do everything. It's too much. I'm stressed. And so we talked about what could they delegate. And the one partner delegated doing holiday cards to the other partner. So I met with them. It was the first week of December. And I said, how are things going? And the partner who typically did a lot of the things said, well, I'm really frustrated because my partner agreed to do the holiday cards. It's December 5th and nothing has happened yet. And so that's often what tends to happen is the person with OCPD has a specific way in which they want things done. And the partner gets the sense that it doesn't matter how hard I try to do it, it's not going to be correct. So I'm just kind of done trying. And then it maintains this pattern in which one person feels like they're having to do too much and the other person feels like it's not my fault. Like if I try to do stuff and you're just never happy with how I do it. So that can contribute to difficulties within a relationship. But the same thing could happen on a team at work or on a project. One person feels like they've got to carry the weight because they have a specific way in which they think things should be done. And if they try to delegate, they look at what the other person's doing and they're like, well, that's not right. That's not good enough. And then they kind of take it over. Okay, going to great lengths to avoid wasting time, money, resources. So the diagnostic criteria in the DSM, they use the word miserly. And I don't actually think of it as miserly. Like one of the reasons I really enjoy working with people who have OCPD is because very often and usually most of the time, these are very well-intentioned, kind people who really just want to do a good job in all different aspects of their life. And so often very generous. And so I don't think of it so much as being miserly. I think of it in terms of people with OCPD really value efficiency. And so I think it's less about being greedy, the way you think of Scrooge, and more in terms of they don't want to waste. So they don't want to waste money. So this could be that when they're shopping at CVS, but they see something and say, well, it's $1 cheaper over at Target. So I'm going to drive the 15 minutes over to Target just to get this one product over there because it's cheaper there. And so there's a lot of effort focused on not wasting money in that instance, but also not wasting time. So this person, and we'll talk about the fact that people with OCPD often place a high emphasis on being on time, but sometimes they will be people who tend to run late because they try to fit in one last thing before they leave. So they're trying to maximize how much they can get done within a given period of time. And so sometimes folks with OCPD can run late. I would say less often, but sometimes they run late because they think, oh, I have 10 minutes. I could get this one last thing done before I have to leave. And they don't want to be early sometimes because that's a waste of time. Like, oh, now I'm here 15 minutes early and I could have unloaded the dishwasher, or I could have gotten that one last email out before I left. So there's a high emphasis placed on not wasting. And then the last is not wasting resources. And so sometimes people who have OCPD will kind of have hoarding tendencies. So they might have trouble getting rid of things because you might need this at some point. You might use it. And so they might hold on to seemingly really random or trivial things, like they might, keep a piece of red string because you never know when you're going to use a piece of red string. And then if something comes up, like there's a random holiday ornament and you don't have anything to hang it and you think, I've got that piece of red string, like, aren't you glad that I kept that? Or you get takeout and you take the takeout container and you empty it out. And then you go to throw it in the recycling bin. They're like, no, like, wait, we can use that. And they don't want to waste. So they'll often, and again, any of us can like keep a to-go container because we might use it, but this is like a pervasive pattern of don't get rid of that because at some point we might use it. I had a client, one of the first people I ever worked with who had OCPD, and this is back in the day when we got lots of magazines in the mail, and he had years and years of travel magazines because he said, you never know when you're going to go on that trip. And when you go, I'll have just the travel and leisure for your trip. And so he would keep years of these magazines just in case somebody in his family at one point needed it. Okay, so the person with OCPD may be so exacting or attentive to details that it's difficult to complete projects or meet deadlines. So I've seen lots of different examples of this, but this could be the person who, in preparing their taxes, because we're in April, in preparing their taxes, is so determined to get every receipt and make sure that they have every deduction listed. And they're pulling all of this together to make sure they have all the sheets and receipts that they need, that they miss the deadline. So in their effort to be thorough and complete, the broader point of the process is lost. So yes, you want the receipts and you want your papers in order, but it's important to have your taxes in on time. Or I've worked with undergrads who are so perfectionistic in their writing, they want to choose just the right words. And they want their work to be properly edited and thought through, that they have trouble turning the essays in on time. So, I've seen undergrads who have to take a leave of absence because they can't, if they're in the humanities, they have trouble submitting papers because you could always keep revising and editing. And so they keep going over it and over it until they feel like it's perfect. And as a result, it's difficult to meet deadlines and get all of the required work in. People with OCPD often believe that their approach or their moral code is right. So I did the air quotes thing again. So as I mentioned earlier, there is a lot of focus on this idea that their approach is not just their approach, it is the right approach. And so what they will feel is, look, it's not just that this is my style, it's that this is the right way to do it. And sometimes there's a belief that is universal, that everybody agrees that that is the right way to do it. So I saw a person at one point who said he had OCPD, and he said, I think that my wife hates me. And I said, why do you think that? And he said, because when the clothes come back from the dry cleaners, she hangs them up on the door to our bedroom instead of putting them in the closet. And I said, as one who might tend to hang them on the door instead of putting them in the closet, I said, why does that mean that she hates you? And he said, because who does that? Like, she does that because it's hostile. She knows that drives me crazy. Like, anybody would put their clothes in the closet. And he said, and her dresser is a mess. There are things all over the bureau. And he said, so it's hostile. He said, I think she really does it just to bother me because, like, she knows how irritating that is. And no one just wants their stuff all over their dresser. And having spoken with his wife a few times, I said, you know what? I actually think that if your wife had her own apartment, she may just have her things around the dresser, because I think that just doesn't bother her. Like, she has her system, and needing to have things in order on top of the dresser just isn't part of her system. And I think if she lived on her own, I think that's kind of how she would keep her dresser. So I understand that irritates you, but I don't think she's doing it because she hates you. Like, I think she genuinely has different standards in terms of how she wants to keep her bedroom. And that was kind of mind-boggling to him. Like, he really thought, no, everybody prefers to do it this way. And if she's not doing it that way, it's just to get under my skin. The person with OCPD has difficulty being spontaneous. And they might be annoyed by last-minute change of plans. So these are people who like to plan, and they like to know what the plan is. So they're going to plan ahead of time, or if someone else is making the plan, they may want to know what it is. So one example that people will sometimes give is they'll say, if I meet up with a group of friends and we plan to go to this restaurant, but when everybody gets together, suddenly they start talking about going to a different restaurant, they'll say, that will annoy me. And I'll say, well, do you not like the different restaurant? And they'll say, no, the other restaurant's fine, but that wasn't our plan. Like, why aren't we just doing what we planned? So it's not that the change causes actual negative consequences or is inherently problematic. It's just, if this was your plan, why not stick with it? Or I worked with a college student at one point who had an OC personality style, maybe not full-blown personality disorder, but an OC style. And she was a big planner. And one day she had planned to go to the library and then to work out. And a friend stopped her along the way and said, hey, I just bought a new dress for our formal. Will you come back to the room with me and I'll try it on? You can just tell me if you like it. So my client was nice and she was socially aware. So she thought, you know, I'm going to be a good friend. I'll do it. But she was totally annoyed because this wasn't her plan. So internally, it really irked her because she had her plan and she just wanted to stick with it. Okay. All right. So the person with OCPD may be reluctant to take time off from work. So these might be folks who don't use their vacation time, or on the weekend, they get up early Saturday morning and they're like, all right, I've got the list of things that we're going to do. And if there's talk of doing something fun, they'll say, okay, but not until we get our stuff done. And so they're more inclined on the weekend to use their time to get different things done. And so they've got their errands they're going to run, they're going to rake the yard, and they are more comfortable using their time to be productive and get things done. Their home or office is very orderly and well organized, and the person is irritated when that order is disrupted. So whether it's at home or in their office, they like for things to be organized, and it's not, again, like the person with OCD who has the just right subtype where it makes them anxious if things are out of order, is that it irritates them. Like, you moved that, put it back. Like, why would you move that? This could be a person in parenting. The parent who has OCPD may find it difficult with really young children to just kind of lay on the floor and build with Legos, or to play a game. And they are more comfortable teaching their children things or doing goal-directed activities. So to just kind of sit and play is something that is hard for them to do. And they might be kind of looking at the clock or saying, you know, I'll be right there to play. I'm just going to load the dishes, or I'm just going to get this done. And most parents have felt that pull between playing with their kids, but having things pulling at them that they want to get done. That is common. This is more, it's really, really difficult for this person to spend any time in just kind of free play, and they veer toward more goal-directed activities. As I mentioned, the person with OCPD may assume that everyone shares their preference for having things in perfect order. In many, many cases, great importance is assigned to being on time. And the person may strictly follow a schedule or routine. And again, as I mentioned earlier, like, feel annoyed if they're asked to flex on that. Okay. Then there are thought patterns that are common within OCPD. So black and white or all or nothing thinking is when people think in terms of two extremes. So either you had a dinner party and the chicken was the best chicken you've ever made, Ina Garten couldn't have done it any better, or that was disgusting, I'm so embarrassed, it was overcooked, ugh, it was awful. And there are kind of only two options. Or you're doing a fantastic job at work, people are thinking that you're doing a great job, you've had great success, or that was a disaster and you're worried you're going to be fired. So things often the person will think in very black and white terms. They'll come home and either the house is totally neat and clean and they say, this is relaxing, the house looks great, or they come home and the house is not like that and it's the place is a disaster, this place is a mess. So again, often thinking in terms of extremes, black and white, all or nothing thinking. Catastrophizing, a great verb. And this is when the person, you know, there are things that are objectively catastrophes, the earthquake in Turkey, the floods in Mississippi, that are catastrophes. Catastrophizing in this realm refers to people feeling like anything negative that occurs, like any mistake, is catastrophic. So it's like everything is like a 9 out of 10. So if you have a typo, that's like horrible, totally unacceptable. It's so embarrassing. Any mistake feels like it's going to have catastrophic consequences that, again, if you were to kind of rate how bad is this, like everything ranks as like an 8 or 9 out of 10. So they are overestimating the consequences of something negative happening. Folks with OCPD often have a lot of rigidity in their thinking, and that could show itself in a few different ways. So that could be the rigidity in terms of their plan, like this is how we're going to do things, and it's hard for them to flex from that. Or it could be with what we'll get to in a minute, which is the should statements. So people with OCPD may be rigid in their thinking, like this is how you should do things. And again, it's difficult for them to flex from that. One of my clients who has a very good sense of humor, and again, somebody who she has an OC style, I would say an OC personality style, and she was giving me examples, and she said when we get together for a holiday cookie party, she said if someone brings chocolate chip cookies, she said that kind of irks me. And I smiled because I love chocolate chip cookies, and I said, why? And she said, because chocolate chip cookies are not holiday cookies, which she was laughing about, and I was too. And it was a small example, but that's a good example of when someone does that persistently, that kind of rigidity can be difficult. Okay, it's not me, it's you. So a person who, again, a person who has OCD will tend to come in and they'll say, I know that this is my issue. And I know that other people wouldn't do this. And they can kind of own that the difficulty is theirs. For someone who has OCPD, they will say, the issue is not mine, it's you. Like, this isn't my problem. This is that you need to do this differently. And so their focus is, and this is true for really all personality disorders, a person with a personality disorder typically feels like they are not the problem, like someone else's behavior or outlook or thoughts are the problem. And it's other people who need to change. A person with OCPD may have a mental filter. So a mental filter is when you get focused on one thought, often it's a negative thought, and that creates a filter so that you kind of tune out anything that's not consistent with that thought. So if someone with OCPD said, my partner is totally disorganized and just a mess, then they are going to pay attention to any examples that support that belief. And the times when their partner was organized or efficient or took care of things, they just they don't remember that, or they say, yeah, but everybody does that. And they dismiss it. And what they focus on are just the examples that kind of support their belief. Folks with OCPD have a lot of should statements, and they hold them very firmly. So it could be you should be on time. And of course, some should statements, you can back them up and it makes sense. Like, you should be on time. It's good to be on time, but they have trouble flexing on it at all. So sometimes someone you work with is late for meeting with you, but their child threw up 5 minutes before they were supposed to leave. And instead of saying, I understand, like, that happens to everybody, it's like, well, like, you kind of should figure out a backup system so that when that happens, you're still able to leave on time. Like, it's difficulty kind of flexing from that should statement. And sometimes the should statements are kind of arbitrary should statements. So one of the examples I will sometimes give is within my family. When I was little, my mom made our Halloween costumes. She would make them herself. And when my older sister had children, she made she's a great seamstress, and she would make her kids Halloween costumes. So when I had children, I thought you should make your children's Halloween costumes. So I, for the first few years, was making the Halloween costumes. And then my son said he wanted to be Spider-Man. And I thought, okay, I don't actually know how to sew, so I can't keep doing this. And B, he really wants to be Spider-Man, and they sell the Spider-Man costume right at the store. A person who has full-blown OCPD with an example like this might have trouble flexing from that. Thankfully, I was too tempted by the Spider-Man costume that was on sale, so I bought it. And my son wore the Spider-Man costume all year, and I didn't make the Halloween costumes myself after that for too long. It's wonderful to make Halloween costumes, but not if you can't sew. Okay, and then the last one is, but I'm right. So a lot of times what happens is when people who have OCPD give me examples of the things they're getting stuck on, if they're having conflict with someone, they will explain to me the way in which they, on the merits of the argument, are right. And often they are. So like I saw a couple at one point, and the one person had a strong feeling about turning lights out when you leave the room, not uncommon. And she said, when you leave the lights on, you're wasting electricity and you're wasting money, like our electric bill goes up. And she was totally right. Or someone will say, you know, I want my kids to take their shoes off when they come in the front door, because if they wear their shoes around the house, or if they eat crackers in the living room, it makes a mess. Like there's mud on the stairs, there are crumbs in the couch, and they're right. But sometimes what happens is people get so focused on the fact that they're right, and they enforce that or pursue it because they're right, and then it comes at some other expense. And so what could happen is, like for the person who said, I want my kids to take their shoes off when they come in the house, they value having a clean house, and that totally makes sense. But they also probably value having a peaceful home. And so to call the kids out and get mad at them every time that they forget to take their shoes off compromises the value of having a peaceful home. And so sometimes you're looking at, okay, you are right, but what is the cost of being right? So the person who wanted the lights out, every time she would call her partner out on it and say, you left the light on again, they were saving electricity, but it was wearing on their relationship. And so we're going to talk in a little bit about kind of balancing the different things that you value. But one of the things that I encourage my clients to think about is, you may be right, but is there sometimes a cost to being right and like pressing the point that you're right? And is that coming at the cost of something else? So kind of thinking bigger picture, and we'll talk about that. Okay. All right, so we're going to move into treatment. So CBT teaches patients to examine patterns in their thoughts and behaviors and modify the ones that are not accurate or helpful. And we'll talk about what that looks like. Sometimes when I start to talk about treatment and talk about perfectionism, people with OCPD will say, whoa, like I like that I do things really well, and I'm not looking to change that. That's an important part of my identity. So I always clarify with them, absolutely hold high standards and do an excellent job on things, but we're going to work on tolerating less than perfect, because you can't actually do things perfectly all the time. And so it's really helpful to see the value in good enough. And treatment emphasizes that while there are many different personalities and styles, there isn't one that's right. Each personality style offers different pros and cons. And so part of the goal of therapy is to help people recognize and appreciate the different pros and cons of different styles. They have pros and cons in their style, and other people do as well. So that it moves away from the idea that there is a right style and kind of a better style, a correct style. But instead, you know what? We each have a different personality, and each personality comes with its benefits and its drawbacks. Okay. All right. So we talked about establishing that curbing the perfectionism is not about embracing mediocrity. The person can continue to hold high standards, achieve excellence, do extremely well, but in the end, get comfortable with good enough. Okay, and then we're going to work on challenging some of the mistakes that people can make in their thinking. So when people are very black and white in their thinking, we work on helping them to operate in the gray. So it's not that either your dinner was Ina Garten level or it was disgusting. Like, let's talk about some options in between. Like maybe it was not the best chicken you've ever made, but it was very good. Or maybe it was not the most successful project that you've ever worked on, but it had a lot of strengths. So helping people to kind of operate in the gray. When people are catastrophizing, we will work on decatastrophizing. So helping people see that, yes, like it's true, no one likes to have a typo. I guess I'm sure some people don't care, but many of us don't like to have a typo in their work. People don't like to make mistakes in their work or make mistakes in doing different things. But let's look at whether it was really the end of the world and what were the consequences of making that mistake. Overgeneralization is when a person takes one instance and they generalize based on that. So if their partner forgets something, it's, I can't ever depend on you. Like you're always forgetting stuff. And encouraging people, teaching them to speak in more specific and accurate terms. Like, you forgot that today and that frustrated me, that made me upset, instead of these broad sweeping statements. And then we help people examine their should statements, either to determine whether there are sometimes should statements that don't really have a lot to back them up. Like it's actually okay if I don't make my homemade Halloween costumes, or there should statements that you do hold, but it's okay to sometimes flex on them. Okay, and then people with the OCPD often point out that they are right in their argument, as I mentioned. So we work with them on looking at the cost of pressing that point. So I described that a little earlier. And sometimes we compromise on high standards or flex on rules for the sake of other things that we value. So one of the things I'll ask my clients to do is write out a list of the different things that they value. So they may value high achievement, they may value doing like getting a 4.0 in school, doing things in a very, very excellent way. But what are the other things that they also value? So I worked with a med student who was very smart, very hardworking, and wanted very much to do his coursework in med school really, really well. He wanted excellent test scores. And that's all great. And I think that's true for many med students. But what I asked this person to do was write out a list of the things he valued in addition to academic achievement. So a person might say, I value my friendships, I value family, I value taking care of myself, working out, I value doing something to help other people. And so I asked him at the end of each day to check off the values that he had given time to. And if he had only given time to academic achievement that day, then he was pursuing that goal at the expense of the other things that he also valued. So we worked on achieving more of a balance where there would be time given to academic achievement, but not only that, like there would also be time given to other things. And sometimes we compromise on one value for the sake of another. And so you might say, I could spend more time on this project for work, but I'm going to stop that because I also value spending time with my friends, or I also value doing things that are fun. And so sometimes you deliberately choose to compromise on doing things perfectly, or you deliberately decide it's okay to flex on a rule because there's something else that I also value, right? Oops, okay. All right, so the other thing that we do in CBT is we encourage people to conduct experiments. So this can sound a little funny, but I'll explain how it works. So I will ask my clients to sometimes deliberately do things less than perfectly. And this could be anything. It could be submit that essay knowing that there are some typos in it, not because you're going to make it your practice to do that, but just because you test out what actually happens when you turn in a paper that has typos in it. And usually what happens is you get the paper back and there weren't really any negative consequences. The professor doesn't suddenly think that you're not smart or that you're not a good student. Or I had one client who really liked to do everything perfectly. So even for holiday gifts, she would choose the perfect gift and then the perfect paper and the perfect wrapping and a perfect gift tag. And so I asked her to choose wrapping paper that she thought was ugly and use the wrapping paper that she didn't like. So it didn't have to be heinous, but like paper that she just thought looked kind of cheap or wasn't that nice, and give out gifts wrapped in that paper and see what happened. And you kind of test out, okay, so when I do things less than perfectly, what happens? And that's not, again, because you're now going to always buy ugly wrapping paper and you're going to turn in paper with typos. It's so that you can feel less anxious and feel more comfortable with the idea that I set my standards high, I try to do things well, but I can turn it in or I can give this out without worrying that if it's not perfect, something terrible is going to happen. Or I will ask people to do something less than 100% efficiently. So divide the bill evenly when you go out to dinner, even though you only got one drink and a salad and your friend got steak and 3 drinks. And that's not correct and it's not efficient, but you compromise on the efficiency cost-wise for the sake of just having a fun and relaxing night with your friends and not sweating in the end over who got what and dividing it, accurately. Practice being flexible. So that could mean that you had a plan, but when someone says, what if we do this instead? You say, I don't like that because I wanted to stick with our plan, but I will be flexible. So people practice being flexible in that way. Or if someone is late meeting you and you think this irritates me, and I kind of want to ask them why they're late, you decide you're going to let that go and kind of see what happens. And often what people find is that there is a benefit to that. Not only does nothing bad happen, but often people appreciate that flexibility. And we all need a pass once in a while. So people also appreciate getting a pass. And we'll talk about that more in a minute. Okay, set a deadline for a project and stick to it. Submit it, even though it could use more work. So this is about balancing. I value doing things really well with there is also value to getting things turned in and getting things done on time. So I've worked with a few people who, I mentioned college students who have trouble meeting deadlines, but I've also worked with professionals who are trying so hard to do their project thoroughly and completely that their work is piling up and they get into trouble with their supervisor because they're so behind in all that they're supposed to be doing. So there is value to doing the work really well, but there's also value to just getting it done and keeping up with your work. Okay, giving someone a pass at least once a day. This is a great thing for someone who has an OC style to work on, that like once a day, they're going to give somebody a pass. And that means not pointing out what the person did less than perfectly. So if they make a mistake, you say, you know what, I'm just going to let that go. Or if the person's late, you don't mention it. Or if you delegate something and the person didn't do it completely the way that you would have liked or correctly, you let it go and just say thank you. So I worked with someone who had OCPD one time, and she was working on delegating and giving a pass. And so I saw her and I said, how are things going? She said, I did such a good job this week. And I said, so what happened? She said, I let my partner make dinner for the kids. And when I came home and the kids were eating hot dogs, I said, I am not pointing out that you gave the kids hot dogs. I'm doing a really good job. I'm giving you a pass. And I said, okay, that is not technically giving the person a pass because you just called them out on giving the kids hot dogs. So giving a pass doesn't mean that you announce that you're letting it go. It means you genuinely let it go. You don't say anything. Plan to be spontaneous, which sounds kind of funny, but I actually set this up with people as homework. Like, plan that one day this week you are going to do something spontaneous, which may mean that you leave work a little early one day. It may mean that you decide to do something different for lunch, but make it a goal that once this week you are going to do something spontaneous or do something fun, like take time away from your to-do list on a Saturday and make a point just to do something fun and practice doing that. For people who do that all the time, that can sound silly, but for people who don't feel comfortable backing away from work, it takes some practice to get comfortable protecting time for fun. Okay, and then discuss the benefits of being a person who does things extremely well and holds high standards, which the person will like hearing and feel good about. But then you can talk about, all right, but are there any downsides to this style? And examples would be like, is it ever hard for the people you live with or people you work with because they often feel corrected or feel like they can't do things well enough? Or is it sometimes hard to get work done on time because you so want to do it correctly? And give some of the examples of some of the downsides to that style. And then look at, well, what are some of the benefits of other styles? So like if I were working with a physician who kept like very detailed notes and they said, my notes are great, like anybody could jump in and take care of my patient on a given day because I write really good notes. And there is value in that. But if that physician falls behind because writing the notes takes them so long, then that might mean that when someone else opens up the chart, there isn't a note there. So the other physician who writes shorter notes that aren't as beautiful, aren't as thorough, but the notes are done, there is value to that. Or in a couple, one person might be super organized, have an OC style, they are really good at managing things. The other partner may be kind of more disorganized, more apt to forget things, but really fun, and a really positive presence and energy. And so each style offers something. And so it's not that one style is better, they each have strengths. And in a relationship, in a couple, what we'll focus on is, can they each borrow from the other person's strengths so that their relationship challenges both of them to grow? All right, so when a person with OCPD is pointing out, these are all the problems in this other person's style, you want to help them see, okay, but what are some of the benefits of that person's style that may be very different from yours, but they kind of bring their own benefits to the table. Like they might be great at getting along with everybody in the office and good at working with people and easy to collaborate with. So each style has its own benefits and drawbacks. Okay, and now strategies for family, friends, coworkers. First is to understand that this, if it's someone else who has the OC style, their standards, their behaviors are part of their style. That is their style. It would be their style no matter who they were working with, no matter who they were living with. So try not to take it personally. And then rather than debating whether the person is right, acknowledge any merit. Like, you're right, there is more mud on the stairs when the kids wear their sneakers all through the house, but we also want the house to be a relaxing and comfortable place where they're happy to have their friends over. And so you're just kind of pointing out to them that there's more than one value there. Or it's true that when we turn all the lights out, our electric bill is lower and we're saving energy. But it's also really nice when we're not correcting each other and we can just relax and enjoy being at home. And so you acknowledge the part of their argument that you can see is true and right, but you point out the other things that they might also value. And then getting back to what I was mentioning earlier, you can think and talk about each of your approaches and what are the pros and cons of each. Very often, couples got together because they each appreciated and benefited from the other person's style. And then over time, those differences start to wear on them. But if you can kind of get back to appreciating the benefits of those differences, that can be helpful. Okay. All right. So thank you for listening, and take care. Have a good spring.